Hey everybody, it's Julia Kavanaugh and
I'm Nancy Ham.
welcome to Postpartum Perspectives, the place to come to hear all things newborn care and postpartum related.
We hope you enjoy the following podcast.
Hey everyone, welcome back. Today we are going to do a deep dive into holistic approaches to pregnancy, labor, birth, and breastfeeding.
Sounds exciting.
We have got a really interesting mix of sources for this one, and I can't wait to really dig in.
Me too.
But before we get started, I do want to just give a quick reminder that we're not medical professionals here.
Right.
So think of this deep dive as a chance to explore some fascinating ideas, not as like a source of medical advice.
Agreed.
Okay, so one of the things that really caught my attention when I was prepping for this episode is this idea that even before birth, a baby's temperament can be influenced by the mother's stress levels and overall health.
That's so interesting.
Isn't that wild?
It really is, yeah.
It really highlights the incredible interconnectedness, I think, between a mother and her baby, and it really underscores the importance of a holistic approach to pregnancy.
Absolutely.
So let's talk about what we mean by holistic.
Okay.
I found this definition that really resonated with me. It describes holistic health as treating the whole person, body, mind, and spirit, rather than just focusing on individual symptoms.
I love that. What are your thoughts on that?
I think that's a great way to put it.
Yeah.
It's about recognizing that all aspects of our being are interconnected, and that true well-being comes from addressing the whole person, not just isolated parts.
Right.
And, this deep dive will be focusing on some really amazing physical modalities, but it's important to always keep in mind that the emotional and spiritual aspects are equally important.
So true.
Yeah.
And speaking of the mind-body connection,
Yeah.
I came across some research from the Cancer Institute that was really fascinating.
Oh, interesting.
They found that chronic stress can actually contribute to a whole cascade of physical issues, from digestive problems to a weakened immune system.
Wow.
It really makes you think, right?
Absolutely. It shows how our mental and emotional states directly impact our physical health.
And this connection becomes even more crucial during pregnancy, of course,
Mm.
when a mother's well-being is so intimately tied to her baby's development.
Okay, so with that holistic foundation in mind, let's dive into some specific modalities.
Okay, let's do it.
First up, homeopathy.
Ooh.
I'll admit, I always thought it was a little bit out there,
Yeah.
but after reading these sources, I'm definitely intrigued.
I think it's a system of medicine that often sparks curiosity and sometimes a bit of healthy skepticism, for sure.
Yeah.
And the fundamental principle is like cures, like
Right.
using highly diluted substances to stimulate the body's own healing abilities.
Right, and here's where it gets really interesting. There are even connections to quantum physics and the concept of water memory.
That's right.
Like, what?
Yeah, the mechanisms of homeopathy are still being explored, but the safety and non-toxicity make it a very appealing option, especially for pregnant women and infants.
And I was also surprised to learn that despite the common misconceptions, studies actually show that homeopathy users tend to be more educated than average.
That's true, yeah. It's gaining popularity worldwide.
Wow. So let's talk about how this works in practice.
Okay.
What kind of homeopathic remedies might be helpful for a mom to be experiencing anxiety?
Well, aconite is often used for fear and anxiety, especially when it's triggered by a specific event.
Okay, and what about morning sickness?
Oh, yeah,
Are there any remedies for that?
absolutely.
Okay.
Nux vomica is a common choice if the nausea is worse in the morning and accompanied by a sensitivity to smells.
Interesting.
And then there's ipecac, which is helpful when there's a lot of nausea with vomiting, especially if it doesn't bring relief.
Oh, wow, so specific.
Yeah.
What about other common pregnancy discomforts like heartburn or leg cramps?
For heartburn, robinia is often recommended, especially if it's worse after eating.
Okay.
And for those painful leg cramps that can hit at night, cuprum metallicum is often helpful.
Huh.
It's known for its ability to relieve muscle spasms.
That's so helpful.
Yeah.
I'm also curious about homeopathy during labor and delivery. Is that something it's commonly used for?
Yes, definitely. It can be a great tool for supporting a natural birth process.
Okay.
For instance, calophyllum is often used to help strengthen contractions if labor is slow to progress.
Okay.
And then there's gelsemium, which is often used for anxiety and anticipation related to labor.
That makes sense.
Yeah.
Are there any remedies that might be helpful after the baby is born?
Yes.
Okay.
Arnica is a very popular one for postpartum healing.
Okay.
It's known to help with bruising, soreness, and overall recovery after labor.
Makes sense.
And Staphysagria is often helpful for emotional sensitivity and feelings of being overwhelmed, which are common in those early weeks.
Those are great examples.
Yeah,
And I love that homeopathic remedies are so easy to find. You
Yeah.
can even get them at places like Whole Foods and Sprouts.
that's right.
So convenient.
Easy peasy.
All right, moving on from homeopathy, let's talk about another modality that really piqued my interest, pediatric chiropractic. I had no idea that even a natural birth could cause spinal misalignments in infants.
It's true.
Wow.
Even a seemingly straightforward birth can put stress on a baby's delicate spine and nervous system.
Oh.
And those misalignments can lead to various issues, such as colic, breathing problems, and even trouble with nursing.
It's amazing to think how such tiny misalignments can have such a huge impact.
I know, right?
Can you explain a little bit about why that is?
Yeah, you can think of the nervous system as the body's main communication highway.
Okay.
So if there are any roadblocks or interferences along the spine, it can disrupt the messages between the brain and the rest of the body.
That makes a lot of sense.
Yeah.
So how can chiropractic care actually help with these issues?
Well, chiropractic adjustments can gently realign the spine and remove those interferences, allowing the nervous system to function optimally.
I see. Can you give us some specific examples of how adjustments might benefit a baby?
Sure, let's start with colic,
Okay.
which is a really common and frustrating issue for both babies and parents.
Oh, for sure.
Studies have shown that chiropractic adjustments can be incredibly effective in relieving colic symptoms,
Wow.
with some research suggesting a success rate of up to 94%.
That's impressive. What about other common infant issues like GERD or breastfeeding difficulties?
Chiropractic care can be helpful for those too.
Okay.
For GRD, adjustments can help relieve pressure on the diaphragm,
Okay.
which often contributes to reflux.
Right.
And for breastfeeding, adjustments can help improve the baby's latch and make nursing more comfortable by addressing any restrictions in the neck, jaw, and shoulders.
I read a study that found chiropractic care improved breastfeeding latch in 100% of the babies studied.
I know, amazing.
That's incredible.
It is.
It really emphasizes the importance of ensuring that a baby's nervous system is functioning at its best,
Right.
especially during those crucial early months of development.
Exactly.
Yeah.
And it's important to note that pediatric chiropractors use very gentle techniques, so it's perfectly safe and comfortable for even the tiniest babies.
That's great to know. All right, we've talked about homeopathy and pediatric chiropractic.
We have.
Now let's move on to craniosacral therapy, which also focuses on the nervous system, but in a slightly different way.
That's right.
Okay.
Craniosacral therapy is a very gentle, hands-on approach that addresses the flow of cerebrospinal fluid, which surrounds and protects the brain and spinal cord.
It sounds like it's working with a very subtle system in the body.
It is.
Okay.
Any restrictions in that system can have a ripple effect throughout the body, impacting everything from sleep to digestion to emotional well-being.
Interesting.
It's especially helpful in addressing any lingering effects of birth trauma.
It sounds like craniosacral therapy, much like chiropractic care, is all about restoring balance and harmony to the nervous system,
Absolutely.
which plays such a vital role in overall health and well-being.
Yes.
Now, let's shift gears a bit and talk about herbal remedies.
Okay, great.
Right.
And I think it's important to start by acknowledging that herbs are powerful, and caution is always advised, especially when we're talking about infants.
Right.
It's always best to consult with a qualified herbalist or healthcare provider before giving any herbs to a baby.
Absolutely. And I know that even for moms, the effects of herbs can be more pronounced during pregnancy because digestion slows down.
Yes.
So that means herbs can potentially have a more heightened and longer lasting effect.
That's an important point to remember.
Right.
Now, while many herbs should be avoided during pregnancy and infancy,
Right.
there are some that are generally considered safe and can be very beneficial.
I'm curious to hear about those. Are there any safe and commonly used herbs for babies that you can tell us about?
Well, chamomile is a great one.
Oh, yeah.
It's very gentle and soothing, and it can be helpful for calming a fussy baby and promoting sleep.
I love chamomile tea.
Yeah.
So good.
What are some other safe herbs for little ones?
Yeah, what else?
Ginger is another good one. It's excellent for digestion and can help with gas and colic.
Oh, nice.
Yeah.
What about herbs for moms during pregnancy, labor, and breastfeeding?
Yeah.
I know a lot of women use raspberry leaf tea, for example.
Yes, raspberry leaf is very popular. It's often used in the later stages of pregnancy to help tone the uterus.
Okay.
And some believe it can help prepare for labor.
Okay.
And then there's ginger, as we mentioned earlier, which is great for nausea throughout pregnancy.
What about herbs that can help support labor?
Red raspberry leaf is often used during labor as well, with the thought that it can help strengthen and regulate contractions.
Interesting.
Yeah.
And for breastfeeding, I've heard that fenugreek and blessed thistle can help with milk production. Is that right?
Yes, those are two of the most commonly used herbs for boosting milk supply.
So many incredible herbs.
I know.
But it sounds like the key takeaway here is to do your research, consult with an expert, and always use herbs wisely and respectfully, especially when it comes to babies.
Couldn't agree more.
Yeah.
Herbs are powerful allies, but they need to be treated with respect.
Well said.
Thank you.
Okay, let's move on to another modality that's becoming increasingly popular, acupressure.
Okay.
It's like acupuncture, but without the needles, right?
Exactly. Acupressure involves applying pressure to specific points on the body,
Okay.
which can help to relieve tension, stimulate healing, and restore balance to the body's energy systems.
And I've read that it can be really effective for all sorts of things, from constipation and colic in babies to pain relief and nausea for moms.
Yes, it's a very versatile modality,
Wow.
and it's gentle enough to be used on babies and throughout pregnancy.
Okay.
There are even specific acupressure points that can be used during labor for pain management.
Incredible. Can moms do acupressure on themselves, or is it bad to see a practitioner?
While there are some self-acupressure techniques that can be learned, I always recommend working with a qualified acupuncturist, especially during pregnancy.
Good to know. All right, last but not least, let's talk about essential oils.
Okay.
I know they've become really popular, but I'm always a bit hesitant to use them around babies.
Yes, safety is absolutely paramount when it comes to essential oils, especially with infants.
Right.
It's crucial to dilute them properly, use them sparingly, and avoid using them on babies under 3 months of age.
Okay.
And as with herbs, it's always best to consult with a qualified aromatherapist before using essential oils during pregnancy or with babies.
Are there any essential oils that are generally considered safe for babies over 3 months old?
There are a few gentle ones that can be used with caution.
Okay.
Geranium, lavender, frankincense, and myrrh are often used for their calming and soothing properties.
What about essential oils for moms during pregnancy?
Yeah.
Any favorites?
Lavender is always a classic choice for its calming and stress-reducing effects.
Oh.
It can be really helpful for sleep support during pregnancy and for creating a relaxing atmosphere during labor.
What about for nausea or digestive issues?
Peppermint can be really helpful for those things, but it's one that should be used with caution and in moderation. Ginger is another option for nausea that can be really effective and is generally considered safe for pregnancy.
I also read about a study where diffused orange oil reduced stress levels during labor.
Really?
That's pretty amazing.
That is amazing.
Essential oils can be really powerful tools for creating a supportive and calming environment during labor.
For sure.
And there are some, like tea tree, that can even be helpful for postpartum healing.
Right.
I remember reading a story about a mother who successfully treated a clogged milk duct with lavender oil.
Wow.
That's pretty incredible.
That's great.
But I know there are also certain oils that should be avoided during pregnancy.
Yes.
Can you talk about that a little bit?
Absolutely.
Right.
It's so important to do your research and consult with a qualified aromatherapist to make sure you're using oils safely and appropriately during pregnancy.
Right.
There are certain oils that are known to be emmenagogues,
Amenagogues.
meaning they can stimulate blood flow in the pelvic area and potentially pose a risk during pregnancy.
I see. Okay, so we've covered a lot of ground here. Homeopathy, pediatric chiropractic, craniosacral therapy, herbal remedies, acupressure, and essential oils.
We have. That's a lot.
What an amazing array of modalities to support moms and babies throughout pregnancy and beyond.
I know. It's really exciting.
But now I'm really excited to dive into a topic that's so important and often overlooked: breastfeeding support.
Me too.
Yeah, I think it's important to acknowledge just how amazing breast milk is.
It's a superpower.
It's true. I mean, it's constantly adapting to meet the baby's needs, even creating antibodies based on the baby's saliva.
It is incredible.
How cool is that?
It really is remarkable.
Yeah.
And the benefits go far beyond just basic nutrition.
Right.
Breast milk contains components that can help regulate a baby's temperature, reduce inflammation, and even fight off infections.
I also read that breast milk contains stem cells, which have incredible potential for healing and regeneration.
That's right.
And it even has hormones that promote relaxation and bonding between a mother and her baby.
It's true.
It's truly an incredible substance packed with benefits that we're still just beginning to understand.
I know. We're always learning more.
It's true.
And yet, so many mothers struggle with breastfeeding, often due to a lack of support or accurate information.
That's why I'm so glad we're talking about this today.
Me too.
So let's talk about how we can use holistic approaches to empower mothers and make breastfeeding a more positive experience.
Okay.
First up, let's tackle one of the most common challenges: Sore nipples.
Yeah, good one.
It's something that almost every breastfeeding mother experiences,
Right.
but it doesn't have to be debilitating.
Absolutely.
So what can we do?
Well, sore nipples are often caused by an incorrect latch. So working with a lactation consultant to ensure proper positioning is essential.
I know a lot of mothers use lanolin, but I've heard that it's not as safe as it's often made out to be.
Yeah,
Are there any natural alternatives that are more gentle and effective?
absolutely. Coconut oil is a great option.
Yeah, coconut oil.
It's naturally antifungal and antibacterial, and it's perfectly safe for babies to ingest.
What about for overall lactation support?
Yeah.
Are there any herbs or remedies that can help boost milk supply?
Yes, there are several.
Okay.
Fenugreek, as we mentioned earlier, is a popular choice,
Right.
and so is blessed the thistle. You can take these herbs in capsule form or brew them into a tea.
Are there any homeopathic remedies that can be helpful for breastfeeding mothers?
Yes, there are a few key remedies.
Okay.
Cowflower 6X is a great one for supporting bone growth and muscle development in both the mother and baby.
And what about for those moments when a breastfeeding mother feels just depleted and exhausted?
China 3X is often used for addressing fluid loss and boosting stamina,
Okay.
which can be really helpful for mothers who are feeling drained from breastfeeding.
Those are great tips.
Yeah.
Are there any specific acupressure points that can be used for increasing milk production?
There are. A qualified acupuncturist can show you how to locate and stimulate those points effectively.
I'm really starting to see how holistic approaches can offer such a wealth of support for mothers and babies throughout this entire journey.
It's all about empowering mothers with knowledge and options so they can make informed choices and create the experience they desire.
Well said. I feel like we've covered so much ground today, but I know there's still so much more to explore.
There is, yeah. And
Yeah.
I think the most important takeaway is that there's no one-size-fits-all approach.
Right.
What works for one mother may not work for another. So it's all about finding what resonates with you and your individual needs.
Absolutely. And I'm already brainstorming some follow-up questions I have based on what we've discussed today. But before we move on, I wanted to just reiterate the importance of seeking professional guidance, especially when it comes to using herbs, essential oils, or any type of alternative therapy.
I completely agree. This deep dive is meant to be informative and empowering,
Yes.
but it's certainly not a substitute for personalized medical advice.
So true. All right, let's take a pause here. And when we come back, we'll continue exploring holistic approaches to pregnancy, labor, birth, and breastfeeding.
That's good.
Welcome back, everyone. Before the break, we were talking about some of the challenges mothers can face when breastfeeding.
All right.
And I'd love to kind of talk about that a little bit more and explore some natural solutions.
Okay.
One that comes to mind is mastitis.
Yeah.
It's a condition that I know can be really scary and painful for breastfeeding moms.
It definitely can be.
So can you tell us a little bit more about that?
Sure. Mastitis is an inflammation of the breast tissue that can be caused by a number of things, including blocked milk ducts, bacterial infection, and even stress.
I know that there are antibiotics that can help,
Yes.
but I'm curious to hear about natural approaches to both preventing and treating mastitis.
Yeah. Prevention is always key.
Right.
Making sure the baby has a good latch, feeding frequently, and managing stress are all really important for preventing mastitis.
What about if mastitis does occur? Are there natural things that a mother can do at home to help?
Absolutely. Warm compresses can be very helpful in reducing inflammation and encouraging milk flow.
Okay.
Some mothers also find relief from alternating warm and cool compresses.
I've heard that cabbage leaves can be helpful too.
Yes.
Is there any truth to that?
Yes. Cabbage leaves can actually be very soothing for mastitis. They have anti-inflammatory properties and can help to reduce swelling. Simply chill the leaves in the refrigerator and then place them over the affected area.
That's a great tip.
It is an old one, but a good one.
Yeah, what about herbs and essential oils? Are there any that can be helpful for mastitis?
Yes, there are a few that are often recommended. For essential oils, lavender and tea tree are both known for their antibacterial and anti-inflammatory properties.
I know that essential oils need to be diluted properly, especially on delicate areas like the breasts. Is there a specific dilution that you recommend?
Yeah, a general rule of thumb is to use a 1% dilution for topical application on the breasts. But it's always best to consult with a qualified aromatherapist for personalized guidance.
Good advice.
What about herbs? Are there any specific herbs that are known to be helpful for mastitis?
Yeah, that's what I was going to ask.
Echinacea is a popular choice as it can help to support the immune system, and garlic is another one that's often used for its natural antibiotic properties.
Garlic, okay.
You can take garlic internally or even apply it topically as a poultice.
Interesting. What about homeopathic remedies?
Yes,
Are there any that can be helpful for mastitis?
there are a few key remedies. Phytolacca is often used when the breasts are hard, swollen, and painful.
Okay.
Bryonia is another good choice when the pain is worse with movement and the breasts feel hot and heavy.
It's amazing how many natural options there are.
I know, right?
It's so empowering for mothers to know that they have choices.
I agree, and I think it's important to remember that the body has an incredible capacity for healing. These holistic approaches can be wonderful tools to support that healing process.
So true. Now, I know we can't cover every single breastfeeding challenge in detail,
Right. Yeah.
but are there any other general tips or recommendations you can offer to mothers who are struggling?
One of the most important things is to find support.
Yes.
Connect with a lactation consultant, join a breastfeeding support group, or reach out to other mothers who have been through similar challenges.
Yeah.
Having that support network can make all the difference.
I love that. It really does take a village.
It does.
And I think it's important to remember that breastfeeding is a learning curve for both the mother and the baby.
Absolutely.
It takes time, patience, and practice.
Absolutely. It's a journey.
Yeah,
There will be ups and downs,
of course.
but every drop of breast milk is a gift, and every breastfeeding journey is beautiful and unique.
Beautifully said. We talked earlier about the importance of choosing high-quality essential oils.
Right.
And I'd love to kind of hear a little bit more about that. How can mothers make sure they're choosing oils that are safe and effective, especially during pregnancy and breastfeeding?
That's a great question.
Yeah.
Purity and quality are absolutely paramount when it comes to essential oils.
Okay.
And there's a lot of variation between brands. So look for oils that are labeled as 100% pure and therapeutic grade.
Okay.
This indicates that they've undergone rigorous testing to ensure their purity and potency.
What about organic certification? Is that important for essential oils?
Organic certification is definitely a good sign, as it means that the plants were grown without the use of harmful pesticides and herbicides.
Right.
However, not all high-quality essential oils are certified organic.
Okay.
The sourcing and distillation practices are really what matters most.
Are there any brands that you particularly recommend?
There are several reputable brands out there. Young Living and doTERRA are two that are very popular and known for their commitment to quality.
I've heard of those. I also came across Plant Therapy and Mountain Rose Herbs in my research, and they seem to have excellent reputations as well.
Those are great choices.
Okay.
And the good news is that many of these companies provide detailed information about their sourcing, testing, and quality control practices on their website, so you can do your research and feel good about the oils you're choosing.
Okay, so now I'd like to kind of shift gears a bit and talk about the emotional and spiritual aspects of pregnancy, birth, and postpartum.
Okay.
We've been focusing a lot on the physical modalities,
Right.
but it's so important to acknowledge that this is a deeply transformative time on all levels.
I agree.
So what are your thoughts on that?
Well, pregnancy and birth are profound rites of passage, both physically and emotionally.
Yeah.
And it's so important to honor and support the emotional and spiritual well-being of mothers throughout this journey.
I know that many cultures have beautiful rituals and practices to support women on an emotional and spiritual level during pregnancy and postpartum.
They do.
Can you tell me a little bit more about those?
Yeah, there's a rich tapestry of traditions from around the world that honor the sacredness of pregnancy and birth.
Yeah.
For instance, in many indigenous cultures, there are ceremonies and rituals to connect with the ancestors, bless the mother and baby, and call in protection and guidance.
I love that.
It's beautiful.
It's so beautiful to think about connecting with the lineage of mothers and drawing strength from that ancient wisdom.
I agree.
Are there any examples from modern Western culture that you can share?
Even in modern Western culture, there's a growing movement toward reclaiming the sacredness of birth and creating rituals and practices that honor the emotional and spiritual needs of mothers.
I've heard of things like blessing ways and postpartum closing ceremonies.
Yes.
Can you tell us more about those?
A blessing way is a beautiful ceremony that's often held in the later stages of pregnancy.
Okay.
It's a time to celebrate the mother-to-be, shower her with love and support, and acknowledge the transformative journey she's about to embark on.
It sounds so empowering. And what about a postpartum closing ceremony?
A closing ceremony is a ritual that's often held a few weeks or months after the birth.
Okay.
It's a way to honor the completion of the pregnancy and birth cycle, acknowledge the challenges and triumphs, and welcome the mother into her new role.
I love that. It's like a way to intentionally mark the transition and move forward with a sense of closure and renewal.
Exactly.
Are there any other rituals or practices that you recommend for supporting the emotional and spiritual well-being of mothers?
Journaling can be a really powerful tool for processing emotions, connecting with your intuition, and documenting your journey.
Yeah.
And meditation and mindfulness practices can help cultivate inner peace, reduce stress, and bring you into the present moment.
Those are great suggestions, and I think it's so important to emphasize that self-care is not a luxury.
No,
It's a necessity, especially during that time of pregnancy and new motherhood.
absolutely.
Taking time to rest, recharge, and nourish yourself is essential for both your own well-being and your baby's.
I couldn't agree more.
Okay, so we've covered a lot of ground today talking about supporting mothers throughout pregnancy, labor, birth, and breastfeeding.
We have.
Now, I want to shift our focus to the postpartum period and delve into some traditional practices from around the world that nurture and support mothers during this sacred window of time.
Sounds great. I'm happy to share what I've learned.
Welcome back to our deep dive exploring holistic approaches to pregnancy, labor, birth, and the postpartum period. Before the break, we were talking about the importance of honoring the emotional and spiritual well-being of mothers and how various cultures around the world have developed rituals and practices to support this sacred journey. I'm really excited to learn more about traditional postpartum practices specifically.
Yes, let's dive into that. In many traditional cultures, the postpartum period is recognized as a time of profound healing and recovery for the mother. It's a time when she needs extra nourishment, rest, and support to regain her strength and vitality after giving birth.
That makes a lot of sense. What are some of the specific practices that are traditionally used to support mothers during this vulnerable time?
Well, we touched on belly binding earlier, and this is a great example of a traditional postpartum practice that's found in many cultures around the world.
Right.
It involves wrapping a long piece of cloth snugly around the abdomen to provide support for the muscles and organs as they heal and return to their pre-pregnancy state.
I imagine it must feel very comforting and grounding to have that gentle support around the belly.
It can be. And it's not just about physical support. Belly binding is also seen as a way to help the mother reconnect with her body, feel held and nurtured, and transition into motherhood with a greater sense of stability and confidence.
I love that. What about herbal baths?
Yes.
I've heard those mentioned in the context of postpartum healing as well.
Herbal baths are another wonderful way to nurture and support the postpartum body.
Okay.
Certain herbs are chosen for their specific healing properties, such as reducing inflammation, promoting circulation, easing pain, and calming the nervous system.
What are some of the herbs that are traditionally used in postpartum baths?
Calendula is a very gentle and soothing herb that's often used for its wound healing properties.
Okay.
Chamomile is another popular choice, known for its ability to calm and relax both the body and mind.
Yeah.
And lavender, as we mentioned earlier, is wonderful for promoting relaxation and sleep.
Soaking in a warm herbal bath after a long day of caring for a newborn sounds incredibly restorative.
It can be a truly nurturing experience, and it's not just about pampering. These baths can play a significant role in supporting both physical and emotional healing during the postpartum period.
So we've talked about belly binding, herbal baths, and we also discussed the importance of rest and nourishment during those early postpartum weeks. Are there any other traditional postpartum practices that you think we should touch on?
In many cultures, there's a strong emphasis on community support during the postpartum period, recognizing that the mother needs help and care as she recovers and adjusts to her new role. Mothers are often surrounded by family and friends who provide practical support with cooking, cleaning, and childcare, as well as emotional support and companionship.
It really does take a village to raise a child. Sadly, in modern Western culture, we've lost a lot of that traditional community support.
It's true that many new mothers in Western cultures are often left feeling isolated and overwhelmed, trying to do it all on their own. But thankfully, there's a growing movement to reclaim the importance of community support during the postpartum period.
That's wonderful to hear. What are some of the ways that people are working to bring back that village atmosphere?
Well, postpartum doulas are becoming increasingly popular. They offer a wide range of support services for new mothers, including breastfeeding support, newborn care, lighthouse work, meal preparation, and emotional support.
It sounds like having a postpartum doula would be such a gift for a new mother.
It definitely can be. And there are also community-based programs and support groups that offer a sense of connection and belonging for new mothers. These can be wonderful resources for finding friendship, sharing experiences, and getting advice from other mothers who are going through the same things.
It's so important for new mothers to feel supported and cared for during this time of transition. This has been such an incredible deep dive, and I've learned so much. Any final thoughts before we wrap things up?
I would just echo what we said earlier. This has been an overview of various holistic approaches to pregnancy, labor, birth, and postpartum care. But it's really just the tip of the iceberg. I encourage you to delve deeper into any of these topics that particularly resonate with you. There's a wealth of information out there.
And to consult with qualified healthcare providers for personalized guidance.
Exactly. This deep dive is meant to be a starting point for your own exploration.
Well said. I'm leaving this conversation feeling so inspired by the wisdom of the body and the incredible power of these holistic approaches to support the journey of motherhood. Thank you so much for joining us today. We hope this deep dive has sparked your curiosity and empowered you to explore the many ways to support a healthy and joyful journey into motherhood. Until next time, keep learning, keep exploring, and keep trusting the wisdom of your body.